The healthcare exchanges that are going to be, the states are going to be forced to set up, are going to give choices to individuals. Right now, if you have an employer plan, you will be, employer can still offer you that plan. However, some of his incentives to have good plans will be lessened through this bill. So perhaps your employer will find it more better for his business if he then does not offer anyone insurance. So if he doesn't, and pays the penalty. So okay, this happens to you, your employer looks at everything and says, I can't pay $20,000 an employee, so I'm gonna pay the penalty on you. Then you then have to decide on what to do. You still are under the mandate. You must cover yourself with insurance or you will be fined. Now you can accept the fine and pay the fine each year, which is going to be less than the insurance that's going to, the cost of the insurance offered to you. And then what comes in is that deal with insurance companies where they're going to be forced to cover you. When you're sick, you can go and buy a plan. When you're well, you can cancel the plan. So, I mean, I'm not a genius, but I can see that that's not a good business to be in. Insurance companies won't make money on that, so why should they do it? The employer is so uncertain because this law, the calculations in this law are unbelievable. Excuse me. The employer has to tell you if he has a private plan, offer you a state exchange alternative. If one of his employees takes the state exchange alternative, then he's going to be fined for all his employees. It doesn't make any sense to me how they calculate this, but I can tell you that if I was a small business owner, an employer, I would be very frightened. I wouldn't be expanding my business or hiring anyone new to work for me. So I think that's going to be a ramification of this bill. So I think we're going to go on to what Dr. Jill Vecchio thinks her reform should be.
Number 7.
Are you ready for that?
Yes.
Okay.
Do you guys feel like one more? She has some ideas on, I don't think she gets into tort reform, but she has some ideas on her thoughts. It's about maybe a 10-minute video. Do people feel like doing that, or any questions right now?
Employers, how it affects doctors, how it out of the insurance business, including Medicare and Medicaid. Find a way to make those financially viable.
So what she's saying is she'd like to see the government get out of insurance.
With millions of pages of new regulations. I'm Dr. Jill Vecchio, and I'm a practicing radiologist who's read the healthcare law. Now, we've been going through it. We've done coverage, costs, state healthcare exchanges, how it affects employers, how it affects doctors, how it affects you as patients. We've gone through judicial and constitutional issues, and now we're going to talk about real ideas for healthcare reform. First, let's review some of the things we've learned. First, not everyone will be covered. In fact, the number of uninsured may actually increase. The costs of healthcare and premium costs will increase. Taxes and costs of goods will increase. Government regulation will skyrocket with millions of pages of new regulation. Healthcare will be rationed. Doctors will leave their practices, and Americans will lose their freedom. Now, some of the ideas for healthcare reform, and we're going to talk about all these one at a time. Post prices. Everybody should know what our prices are. Separate insurance from the workplace. Use health savings accounts, or encourage the use of health savings accounts, which is real insurance with catastrophic coverage. Get the government out of the insurance business, including Medicare and Medicaid. Find a way to make those financially viable. Eliminate state mandates or decrease them significantly. Allow people flexibility in the choice of their insurance policies. And we're going to talk about tort reform. So let's get started. So we think that providers should post their prices for services. As it is, if you ask me how much a mammogram costs, I wouldn't be able to tell you because it's different depending on whether they're Medicaid, Medicare, what third-party insurance they have, whether they're paying cash, what kind of a policy they have exactly. So Those costs are different for everybody, which is ridiculous. Everybody should know what their costs are. Medicine shouldn't be any different than any other industry. So we say post your prices for everything so people can see. Eliminate the CPT codes at least as much as possible. Those codes that we talked about. Increase the overhead for providers and doctors' offices immensely. If we could just get rid of that part of the overhead because we're posting our prices, right? So we don't need those codes if we're posting our prices. So that will decrease our overhead by somewhere between 5 and 40% for some practices. That's an immediate decrease in the cost of healthcare that can be passed on to patients and consumers. It allows for creative pricing and competition. If everybody's prices are posted, then they can say, oh, well, we're running a special on CTs, or where you can have a membership in an imaging center or a membership in a hospital that you can get a little decreases in your prices, little discounts. You can have senior discounts like you can for everything else. Run it the same way you run other industries. Let the competitive pricing of the market system decrease healthcare costs. It also allows for doctors and providers to provide free care. There are actually some limitations and government regulations about who can get free care. Why is that? We should be able to do the same things that any other group does. And if someone is really in need, the American people and the American physicians and the American healthcare system is not going to allow people to suffer needlessly. Health savings accounts. This is real insurance. Right now, about 14 million Americans have health savings accounts. This is, you have a high deductible, somewhere between $4,000 and $10,000 deductible, but you're allowed to save money pre-tax, tax-free, or tax-credited into these health savings accounts that can only be used for medical expenses. Then you have a catastrophic health care insurance plan. And the premium costs for those insurance plans are about half the cost of a standard first dollar coverage or whatever, insurance policy. So that the premium costs are much lower. And I haven't talked to a single person with a health savings account type plan with catastrophic insurance that doesn't love it. So 14 million Americans have it. Now, it's important to know for you 14 million Americans that have it, that Obamacare or PPACA has several parts to it that will severely limit, if not eliminate, your option to have a health savings account in the future. So they have these medical loss ratios, and I won't go into detail about that, but a medical loss ratio that's imposed on the insurance companies that may prevent them from offering very many of these health savings accounts. Some of them are already announcing that they're going out of the health savings account business altogether, because they would be violating, they wouldn't be able to comply with that regulation of the healthcare law if they offered a lot of health savings accounts. That's important. Another thing is they have decreased the amount of money you can put into some of the flexible savings accounts, flexible medical savings accounts, and they're increasing the penalty for taking cash out of those for people who have been unemployed for a long time or something, some personal issue that you want to take money out of your health savings account for something other than medical expenses. They increase the penalties for that. So the health savings accounts in a way are kind of under fire. So pay attention to that. With the health savings account, you can accumulate a lot of money over time to help pay for your premiums and your deductibles. Patients are in control of the healthcare expenditures from first dollar, which means that they get to shop around. If your doctor recommends some medication and you say, well, how much is it? Well, now that we're posting our prices, we'll know how much that is, right? So your doctor's going to say, oh, well, this is $95 a month. And you can say, are you nuts? Give me something that's $20 a month. Isn't there something out there that you can substitute that'll be just as good, or at least that we can try? Sure. So that puts patients in charge of their health care. That's good. Gets the insurance companies out of the decision-making process until there's a catastrophic event. And that's what we want. That's what insurance is for. Now, we also want to separate health insurance from the workplace. So employers get a tax benefit. They get a tax break when they pay for the premiums for their employees. Why shouldn't individuals get the same thing? Right now they don't. So we're saying, let's give everybody a tax break for medical expenses, including premium costs and so forth. Encourage people, give them incentives to have health insurance. Right now they don't have it, so that's why a lot of people who are self-employed, sole proprietorships don't have the insurance because they don't get the same tax break sometimes. So we also want employers, and as they do now, a lot of employers pay into the health savings accounts or make an allowance for the high deductible payments. And it kind of works, they can work it like a 401k. It could be a more formalized plan, so that there's actually a way there are formalized ways for you to invest your money from your health savings account that you're not using. Invest that in a very low risk entity similar to 401ks, right? So really the 401k system is a great setup for the health savings account system as well. We already have these things in place and people are used to them. So let's just use it for this. Individuals can keep their insurance when they're no longer working for that employer. This is crucial. That's part of the problem with pre-existing conditions, is because people leave their employer and then they try to get insurance in an individual market, but if they have a pre-existing condition, they can't get that insurance, or the premium costs are outrageous. A lot of times they just can't get insurance at all. So let's separate health insurance from the workplace. It's not to say that your employer can't contribute to your costs for health insurance, but the policy doesn't reside with the employer so that you lose it when you leave that employment or move to a different employer, right? So theoretically, you could think that people may have a health policy that follows them from their childhood up. It may not be exactly with the same company. We get to shop around, right? So if the insurance companies don't do what we like, they're not treating us like they should, we don't like the way their customer service is run, then we get rid of them and hire another insurance company. Let's say we have insurance companies that are sold across state lines. National insurance. Why can't our health insurance be linked to auto insurance? Auto, health, home, life. You know, all those things are packaged together and you get a discount. Let's add health insurance to that. Why can't you have an insurance policy that just follows you throughout your life? Pre-existing conditions won't be an issue then, right?
She brings up an interesting issue. We're the only country that really has health insurance through our companies. And a lot of times a person's trapped in the company because they don't want to lose their health insurance. So all the other countries, is what she says, you just go get it. And people might wonder, how did that ever happen? During World War II, they had wage and price controls. So as the people wanted more and more money, they said, we can't. Well, what we're going to do is we're going to give you health insurance. And so it was kind of unusual. Since World War II, it's been sticking around. But every other place, you just go get the health insurance. So if you want to leave your company, you don't worry. I think that's what she was trying to say.